Okay, let's talk about professionalism. A paramedic is a member of healthcare professions. We are we are healthcare professionals. The state of Kansas requires a degree, like many others. Lots of other degrees are available in paramedicine through other universities, through other colleges. I believe there's bachelor's degree. Elsewhere in the world, there are master's degree and doctorates of paramedicine. The recognition is there. We are a healthcare professional. We are not just a technician. We're not just an ambulance guy. We're not just an ambulance driver. We have periodic recertification with a specified amount of continuing education. So we are a profession. We are a healthcare profession. We require a license, a certification, or a certification. In some cases, or some states, a degree. The recognition is there. We require periodic recertification with required amount of hours of continuing education. We promote quality patient care. We demand quality patient care. Because if we're not demanding it and we are not promoting it and we are not delivering it, then in what way are we being a professional? As a professional, we should treat our trade or treat ourselves within our trade as the best of the best. We strive to be the best of the best. We give the best care. We have the best knowledge. We have the best protocols. We have the best scope of practice. We operate to the best of our abilities within our scope. We set and strive for the highest standards. Meaning we set goals, high goals for ourselves. We set high goals for the treatment that we are going to deliver. We are going to treat this patient to the best of our ability and to the best of our equipment and to the best of our knowledge. We're not going to settle for less. Through all of this, we earn the confidence and respect of the team members and our public. Now, like I said, through all of this, we earn the respect and confidence of our team members. Who are our team members? Our team is our partner, co-workers, administration, our nurses, our doctors, in addition to the respect and confidence of these people, through these people, we are in the respect of the public and confidence. We have their respect, and they have the confidence in us and in our skills to take care of them in their time of need. They know that when they call us, they are going to get the best care possible from us that can be delivered. We have certified and or licensed individuals that maintain their certification through recertification, through a required amount of continuing education and professional development. We promote health and injury prevention, health maintenance and injury prevention through programs through the community, through injury prevention programs, fall prevention, through safety and first aid courses, through CPR. We give tours and presentations to the public. We allow them to tour our station and see our equipment. All of this plays in together. We show up. We are dressed appropriately. We are in uniform. Our uniforms are clean. They are pressed. Their boots are polished and in good shape, just like the rest of our equipment. Our uniforms are clean. We don't stink. We take showers. We take care of ourselves. We exercise. We promote exercise and healthy eating programs. We lead by example. Again, I know this is easy to stand here and talk about, especially healthy eating. I eat healthy. I eat more than healthy. But I'm also not standing talking to a patient holding a cigarette in my hand telling them they need to quit smoking. Or I'm not standing at a presentation pulling down donuts and coffee telling people they need to limit their caffeine intake and eat healthier, make healthier food choices. Do I do that sometimes? Yes, I do. Do I do it while I'm in uniform? I absolutely try not to. Within professionalism comes professional ethics. We're going to touch on these. Ethics. What are ethics? Ethics are rules or standards that govern the conduct of members of a particular group or profession. Ethics are not laws. Again, they are standards for honorable behavior. You either have ethics or you do not. You were either taught them at a young age through parents, through grandparents, through aunts, uncles, siblings, or you were not. You can develop them, but conformity to ethical standards is expected. In 1948, the World Medical Association adopted the Oath of Geneva. In 1978, the National Association of Emergency Medical Technicians adopted the EMT Code of Ethics. These documents detail the guiding principles for the EMT service. When you get your handbooks, the Oath of Geneva is in the front of the handbook. I solemnly pledge myself to consecrate my life to the service of humanity. I will give to my teachers the respect and gratitude which is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets which are confided in me. I will maintain, by all the means in my power, the honor and noble traditions of the medical profession. My colleagues will be my brothers. I will not permit considerations of religion, nationality, race, party, politics, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life from the time of conception, even. I will not make use of my medical knowledge contrary to the laws of humanity. I make these promises solemnly, freely, and upon my honor. That is the Oath of Geneva. The EMT Code of Ethics. A fundamental responsibility to the emergency medical technician is to conserve life, to alleviate suffering, to promote health, to do no harm, and to encourage the quality and equal availability of emergency care. The emergency medical technician provides services based on human need with respect for human dignity, unrestricted by consideration of nationality, race, creed, color, or status. The emergency medical technician does not use professional knowledge and skills in any enterprise detrimental to the public well-being. The emergency medical technician respects and holds in confidence all information of a confidential nature obtained in the course of professional work unless required by law to divulge such information. The emergency medical technician, as a citizen, understands and upholds the laws and performs the duties of citizenship. As a professional, the emergency medical technician has the never-ending responsibility to work with concerned citizens and other healthcare professionals in promoting a high standard of emergency medical care to all people. The emergency medical technician shall maintain professional competence and demonstrate concern for the competence of other members of emergency medical services healthcare team. An emergency medical technician assumes responsibility in defining and upholding standards of professional practice and education. Emergency medical technician assumes responsibility for individual professional actions and judgment, both independent and independent of emergency functions, and knows and upholds the laws which affect the practice of emergency medical technician. The emergency medical technician has the responsibility to be aware of and participate in matters of legislation affecting the emergency medical technician and the emergency medical services system. The emergency medical technician adheres to standards of personal ethics which reflect upon the profession. The emergency medical technicians or group of emergency medical technicians who advise professional services do so in conformity with the dignity of the profession. The emergency medical technician has an obligation to protect the public by not delegating to a person less qualified any service which requires professional competence of an emergency medical technician. The emergency medical technician will work harmoniously with and sustain confidence in emergency medical technician associates, the nurse, the physician, and other members of the emergency medical services healthcare team. The emergency medical technician refuses to participate in unethical procedures and assumes the responsibility to expose incompetence or unethical conduct of others to the appropriate authority in a proper and professional manner. That is your EMT Code of Ethics. Those are both in your book, and they are both very good and cover each other very well. You are expected to maintain professionalism at all times, on or off the clock. You are reflected. People know what you do. They've seen you on the streets. They've seen you in the trucks. They've seen you on calls. Your behavior off the clock is a reflection of your behavior on the clock. That's not saying you can't go out and have a good time. It's saying you need to be responsible. They also state that you will maintain a state of readiness. You will do your due diligence in maintaining certification and continuing your education and providing the highest standard of emergency medical care. You will treat your brothers and sisters in emergency medicine, the doctors, the nurses, the radiologists, the radiology techs, the respiratory therapists, and anybody else that I may have forgotten, the phlebotomists, with respect, while at the same time, you will not pass off your patient to a person of a lower ability to care for that patient. Meaning me as a paramedic will not pass off an ALS patient to an EMT or to a ER tech that cannot take care of the patient to the level that I can. Professional attitudes. Establish excellence as your goal. Not gold. Does that mean that your goal needs to be huge? No, small goals, but do it. Create a goal that is attainable, but that you can master. That you can achieve excellence within. Small goals small gains turn into huge gains over time. This test I'm going to get an A on. This quiz I'm going to get an A on. This homework I'm going to get an A on. Eventually that turns into this class I got an A in. This final I am going to pass on the first attempt. This practical skill I'm going to show mastery. I am going to practice until I cannot get it wrong, rather than practice until I get it right. Never be complacent. About performance. What does that mean? I don't know why I keep dotting that. What does never be complacent about performance means? Never be so comfortable that you stop practicing. How often do you really get an intubation in the field? That should be a practice skill. Every chance you get, break out an airway dummy and throw a couple tubes. IV skills. Never be complacent about your performance. Okay, so you've nailed the last 12 of your IVs on the first attempt. That's awesome. There's going to be a time where you miss every IV you do. Never be complacent. Know that there is always room for improvement. Always time to practice and always in need to practice. Practice skills. Always. Take refresher courses. Refresh yourself. Teach them. Teach courses. Teach refresher courses. Take the time to learn how to develop a course, to learn how to develop an education course. Open that up to your coworkers, to your surrounding counties. Get their input. Where can you improve? What can be improved on? What skills do they need? What education do they want? And start developing this. And again, always set high standards. Set high standards. Do not short yourself, your service, or your public. Critically review yourself or have it done for you. Ask somebody to review your information, to review what you have put together. Ask for their input. Ask for their evaluation. Sit down, read what they have to say, listen to what they have to say. Seek ways to improve. We talked about this, and we're going to continue beating this into the ground because it's important. It's part of being a professional, is checking all your equipment. Making sure that you are prepared. Act in a professional manner. On and off the clock. Some attributes. Leadership. I'm not talking just about direction. I'm talking about somebody that is willing to jump down from the desk or wherever that and lead forward, not only in direction, but in example. Are you leading from the front or are you leading from the back? There must be leadership. Integrity. Do what you say what you mean. Apply tact. Don't tear somebody down just for the sake of tearing them down. Be critical, but be fair and be honest. You represent the EMS service and the entrance into the healthcare system. The single most important thing you're going to be judged by at this point is your honesty. Did you do that treatment? Is this what you found on that patient? You are taken at your word on your report. Did you honestly try an IV or did you just look? Was there time to do this or not? How close to the hospital was the call? Did it make more sense just to go to the hospital? Be honest about it. Did you know what you were doing? The biggest thing, I didn't know what to do. Honesty is imperative. You're going to be in a patient's home. I've mentioned it before. You are personally invited into some of the most critical times in a patient's life, in a family's life. The death of a loved one, the birth of the next generation, the loss of a 50 to 60 year partner. You're surrounded by this family's history. You're surrounded by their family. You're entrusted in their home. Do not dishonor that. Empathy. This one's a difficult one for some people. Being supportive, talking. At the same time, being honest. Am I going to die? I'm going to do everything I can to prevent that. I am going to do everything in my power, in my ability to prevent that. Demonstrating understanding of the feelings. You may not understand their feelings, but that doesn't give you the right or mean to be cold and heartless towards this person. Demonstrate respect. Respect the person, respect the location, respect the emergency. And most of all, be calm. It's not your emergency. Be the calm in the storm. Be compassionate. and be helpful. Sometimes it's just listening. Sometimes that's all they need. Just somebody to listen. But you're called to be the calm in the situation. Self-motivation. Complete assigned duties without being asked or told to do so. Completing duties and assignments without the need of direct supervision. Correctly completing all your paperwork on time. Demonstrating that commitment to continued improvement and continued quality assurance. Accepting constructive feedback in a positive manner. And taking advantage of learning opportunities without being pushed to do so. Appearance. Hygiene. Take a shower. Use deodorant. Clean your clothes. Clean, pressed, uniform. Polished boots. Hair under control. Mustaches, beards, trimmed. Fingernails, appropriately trimmed and polished, or polished. You don't, guys don't polish their, but appropriately trimmed and cared for. Jewelry. Minimize your jewelry. You know, we're not wearing chains. We're not wearing rings on every finger. Your wedding ring. What is appropriate for the job? What is professional? What is going to show that you're there to take care of the person? A handful of rings that you're trying to fit your gloves over. And then if you take a glove off and a ring slips off, now you're looking for it. Now you're distracted from your primary cause, which is your patient. Do you have necklaces that are hanging, dangling down in people's faces? Your hair falling down over into somebody's face? People with long hair, men included, tie it back. Keep it under control. If you have a uniform that needs pressed, a pressed uniform, no wrinkles, clean, not stained. You got barbecue sauce on your shirt, take off your shirt, put on a different one, be clean. Understanding that if it happened at dinner and you get called out while you're in the middle of dinner, there's not a lot you can do about that. But you can do about it as soon as you get back to the station. You can take it off and you can have it cleaned and get a new shirt. Appearance, professional appearance and hygiene ties into self-confidence. If I walk in, boots untied, pants over the top of my boots, flopping around, my shirt's untucked, it's wrinkly, do I appear self-confident? Do I appear that I'm in control of myself? Do I have a good professional appearance? No, absolutely not. I look like an idiot. I look like somebody who doesn't care. I just rolled out of bed. My hair's all stuck out everywhere. My beard's off to the side. It's not straight. It's not trimmed. I look like I just got done with a 2-day bender. Hopefully I don't smell like it at least. Have I shown up to work like that? I have absolutely shown up to work like that. Did I stay that way for long? Absolutely not. I have done it out of need because my pressed or clean uniform was at work and I did not remember to take it home. Happened mostly when I could switch to changing at work rather than bringing my uniforms home. Sometimes I don't zip up my boots or tie up my boots until I get there and on the clock. But I'm walking in and the people still see you walking in the door. Could be public, there could be administrative officials in the office when you walk in the door, and that's what they see you walking in like. That does not inspire confidence among your leaders. And it does not look like you take much of yourself. And if you don't think much of yourself, what does it appear that you're going to think of your patients? We are the leader of the EMS team. We are the highest level of care. We must interact with patients and bystanders and other personnel, rescue personnel or law enforcement, in a professional and efficient manner. How are we going to look if we show up, our shirts are untucked, our boots are not zipped or tied, and we show up to an accident scene, fires in their turnout gear? Consider that lucky, I guess, maybe, that they have something that they can cover up with because they can just throw on their turnout gear. Well, we don't. Well, maybe you do, and maybe you can do that. But if you don't, I understand you were woke up at 2 o'clock in the morning. I've been there. I've done that. Does that mean you need to be any less confidence inspiring to the people that you serve with? Let me tell you, they talk about it. I've heard it. We know if you show up to a scene and you look like you just rolled out of bed. Yes, time is of the essence, but you can put yourself together pretty quickly. We're not new to this. Not only that, untucked uniform, loose hair, loose shoestrings, loose clothing of any kind is now just asking to get hung up on something, potentially causing injury or tearing of the uniform, thereby removing any kind of protection that may have offered. There's a reason all this stuff needs to be tucked in and tight, and not just professionalism, but protection-wise as well. We have to have solid communication skills. Does the public understand medicalese? Generally not. Do law enforcement usually understand a medical term that we're throwing at them? No. We need to be able to judge our audience and choose what language we need to speak. Just like law enforcement knows that we don't speak their terms necessarily. And they may have to explain to us what's going on. We have to explain to them what we are doing and why. Same with the public. We need to be able to explain to our patients what's happening and what we're doing in terms that they will understand. Time management. We have a lot to do in a very, very short amount of time. That comes under self-motivation, time management. We need to get what we need done now, within a reasonable amount of time. Diplomacy and teamwork. Diplomacy and teamwork. We need to be able to work with other people. I don't care if you like them or not. You need to be able to work with them. You need to be able to communicate. You need to be able to put personal feelings aside. I may not get along with my partner, but on the call, we know what each other needs to do. We can work together as a team. We know who's lead. We know who's not. If we're a dual medic team, we know that this call is my call, and they will do what I ask. I know that the next call that we go on is their call, and I will do as they ask, to the best of my ability, regardless of who's in charge. We put the patient's interest above our own. We never undermine the role or the opinion, especially in front of others, of our partner or members of the team. We remain open to suggestions. We openly communicate with everybody. And overall, we show the respect for our patient, for the other care team, and for our other team members in the law enforcement, fire rescue, and the public. We advocate for our patient. We defend them, we protect them, and we act in their best interests. We do not allow our personal bias against religion, race, political view, age, color, what kind of car they drive, social status, or legal status. I don't care that they've been arrested. My job is to make him better, if that's in my power, or to get him somewhere where he needs to be taken care of. The only time that is an exception is if our safety is in question. If it's not safe for me to take care of that patient because they're violent or whatever reason, or the area is not safe, then I'm not going in there. Then it's me over my patient. Me and my crew over my patient. And ultimately, careful delivery of skills. We master and we refresh our skills on a regular basis. We show competency. We have to check off on it every year for our services. It is our duty to remain competent and maintain a level of mastery of our skills. We perform and complete equipment checks. If it is our duty, if it is our job, if we have the ability to repair any equipment that may be broken, or report it and record the report so that proper repair can be made. Careful and safe ambulance operations, not just driving pedal to the floor as fast as we can, blowing intersections on our way to a stub toe. We drive with due regard. We have to take care of ourselves first. If we don't take care of ourselves, we can't take care of our patient. And we put other people at risk, mainly the public, the people we are there to protect. We follow policies, procedures, and protocols, even if we disagree with them. Our job is not to decide which procedure or policy to follow, or which we're going to choose to follow. Our job is to follow the policies and procedures as laid out before us. We agreed to do that when we agreed to take on the job. If we disagree with it, we need to develop our argument and present it in a manner that is consistent with professional behavior. We need to research it. We need to suggest improvements, offer suggestions of improvement. Otherwise, we're just whining about something we don't want to do. Continuing education is always on our mind, and we are always talking about it. It is our responsibility. It is our education. It is our responsibility to continue that education. You may not want to become anything more than a paramedic. And that's fine. There's absolutely nothing wrong with that. You may want to go on to nursing. You may want to go on to be a PA. It's your responsibility to maintain that edge, to follow that skill that you want to develop. It is also your responsibility to maintain the skills that you have already gained. It is your responsibility to refresh your knowledge, to take refresher courses, to maintain your licensure and your certification. My challenge to you is through all of this, and you've already accepted it, and you're already doing it, whether you know it or not, which I'm sure you do know it, and continuing education is leveling up. Many of you went from EMT to AEMT. Some of you have ventured into the nursing realm. You are leveling up. Now you're going from AEMT, LPN, I don't remember if there's an RN or not, or EMT to paramedic. You're taking that next step. You are continuing your education. Not only is this going to meet your requirements for continuing education for recertification, refresh what you've already known, which is why we're talking about a lot of this that you talked about in EMT and AEMT. Potentially some of this you talked about in nursing courses. We're talking about it again because it is that important and is that required about us. You develop further knowledge and skills. Take the critical care paramedic course if that is something that interests you. Take the tactical medic course if that is something that interests you. Overall, we maintain our cert or license, depending on what you have, and that is your responsibility. Some services do well in maintaining in-house recertification or refresher courses. Others don't care. That's you. You want to maintain this job, you'll maintain your license or your certification. You develop further skills and knowledge. Take difficult airway courses. Develop more skill sets to maintain your level of care, to extend your level of care. Tactical medicine, flight medicine, critical care transport medicine, critical care EMT paramedic, RN. There are many paramedic to RN bridges out there. PA. Get your bachelor's degree. Go to PA school. With RN, you have NP, nurse practitioner. You can specialize within nurse practitioner to emergency nurse practitioner or family nurse practitioner, whatever you want to do. And then keep up with changes. In emergency care. That is the ultimate goal right here. Keeping up with changes in emergency care is the ultimate goal of continuing education. That you are getting new updates to your care. That you are getting new updates to policies, procedures. That you are getting updates in trends in emergency care and where emergency care is going. As a paramedic, you must be willing to be a leader, be prepared for all emergencies, prepared to respond, and be prepared to take on the responsibilities. On and off duty. Most of your time will be spent preparing yourself to do your job properly, honing your skills. I've heard emergency medicine described as hours of sheer terror, or excuse me, I got that wrong. Hours of sheer boredom, interrupted by moments of sheer terror. During those moments of sheer boredom is where you prepare for the moments of sheer terror. You have a choice of, do I sit in my recliner and I watch TV and eat ice cream? Which sometimes that is preparation in and of itself. Sometimes. Or do I prepare myself, hone my skills to be more prepared for any eventuality that may arise? And adding to that choice, knowing that you have the responsibility to be a leader. You have the responsibility to be prepared and be preparing for all emergencies. To be prepared and preparing to respond. And overall, again, prepared to take on the responsibilities of being a paramedic.